An MP is proposing major changes in how the UK tackles rare and hard-to-treat cancers. Dr Scott Arthur, who represents Edinburgh South West, wants to see improving access to clinical trials, faster drug development and a national research strategy. Now, he was motivated to act after losing his father-in-law to brain cancer in 2018. I spoke to him earlier, but first, let's hear what he said in the House of Commons today.
But the reality is that if someone was diagnosed that day with glioblastoma, they're more than likely to be dead now, and that's how serious this condition is. And they would have been faced by treatments which were out of date, and they would also be, their future would be dominated by uncertainty. And so we should not forget that that is why we're here, is to change that reality for people and for their families. When I was thinking about what I could base the bill on, I was very mindful of the fact that my father-in-law, who was a fantastic grandparent to our children, had died to a type of cancer called glioblastoma, which is a brain tumour. And we knew that the treatments for that cancer type hadn't really progressed in 20 years or so. So we thought that was something that was worth focusing on. The bill itself widened out to encompass all rare cancers, but glioblastoma was a starting point.
Just explain to us what you think the role for government should be here. Often we imagine that charities deal with funding research and looking into cures for cancers, but you obviously think that there's a governmental role here.
Absolutely. I mean, the charities do fantastic work in the sector. I mean, I recently met Sarcoma UK, and over the last 10 years or so, they've raised around £10 million. But realistically, whilst that's a lot of money, it's not going to have the kind of impact that we need, particularly for rare cancers. Pharmaceutical companies, inevitably they're going to follow the market, and so that means focusing on the larger cancers, the more common ones. So it means the rarer ones lose out. So what the bill does is really incentivises pharmaceutical companies to invest more in that space. And of course, charities are going to still keep on raising money for those cancer types, but what I hope is the bill will actually amplify their work. So it's not about replacing it, it's about giving it a greater voice and hopefully bringing in some money from the pharmaceutical industry as well.
So interestingly, from what you say, this doesn't necessarily mean a lot of public money going into this. You want to, as you say, incentivise pharmaceuticals to put more money in. And how do you do that?
So private members' bills, they have to be low or no cost. That's one of the limitations that's placed on them, by and large. So, yeah, so absolutely, you have to focus for where the law can be tweaked, and hopefully that has a big impact. So one of the things we're thinking about, and we'll undertake a review to set the foundation for this as part of the bill, is that we know some drugs which are developed for one cancer type are very effective against another. So it's about industrialising that process by giving the pharmaceutical companies incentives. And one of the incentives we'll look at, which works for paediatric medicines, is saying, well, if you test this drug against another cancer type, we'll extend the patent on that drug. And that means they get a little bit more market exclusivity and more income. But we're expecting at least some of that money to be used in, furthering research into rare cancers. So quite a simple step that doesn't really cost the taxpayer any money. Yeah. But the charities say that'll have a great impact. So
tell me, how successful do you think your bill is going to be? Have you got support from right across the House, from all political parties?
Yes, so today we completed the third reading of the bill. There's a little bit of stress this week dealing with one or two issues, but it completed its third reading today, and I'm hopeful that we'll actually have its first reading in the House of Lords next week. So it should, touch wood, it should complete its parliamentary progress either late this year or early next year, and then once it gets royal assent, it'll become law 2 months later. And then one of the first steps the government will take will be to appoint someone within government to champion research into rare cancers. Just try to organise that whole field and bring the work together.
Dr Scott Arthur there, who's an MP. Now, some of the day's other stories.